Kenji, you can go ahead of me as well.
Yes. Good afternoon. Thank you for joining us here today. To those watching online, thank you for tuning in. I appreciate everyone's interest and attention. These availabilities and the support from our local media provide an opportunity to ensure that we get the right information to our families, friends, and communities. Our province's dedicated COVID-19 website, gov.nl.ca/COVID-19, is a source of trusted and credible information. I encourage everyone to visit the website. It is updated multiple times a day to keep you informed about the pandemic. The websites of the Government of Canada and the World Health Organization are sources of trusted, credible information that people may find helpful as well. As of today, Wednesday, March 19th, we have no new cases of COVID-19 in Newfoundland and Labrador. Of the 3 presumptive positive cases, we now have 1 confirmed case from the National Microbiology Laboratory. In Newfoundland and Labrador, at this time, 684 people have been tested. Of those individuals who have been tested, 681 have been confirmed negative. There are 276 people on self-isolation and followed by public health. I understand questions have arisen from businesses that employ more than 50 people, specifically whether these businesses are being considered as mass gatherings. The businesses that have been ordered to close are gyms and fitness facilities, including yoga studios, tennis and squash facilities, and dance studios. Businesses that hold a license under the Liquor Control Act, whose primary purpose is the consumption of beer, wine, and spirits, cinemas, arenas, performance spaces, and bingo halls. Businesses that employ more than 50 people that do not fall into one of these groups are not required to close. These employers are advised to put measures in place that respect the principles of social distancing and to allow work from home as much as possible. I want to continue to stress the importance of social distancing. Social distancing is a term applied to certain measures that are taken by public health to stop, slow down, or contain the spread of a highly contagious virus. I would like to speak now about the importance of talking with our children about these measures and providing reassurance. We are all adapting to changes in daily life. These changes are significant for our children. Schools and daycares have closed. The daily activities of children have changed substantially. Many children may be feeling anxious or worried. We need to support them, help them adjust to their new routines, and do our very best to help them cope. I encourage you to talk with your children about why we are all taking these measures now. We want to help prevent people from getting sick. Children learn by watching how their parents or caregivers cope in times of stress. I know people may be anxious about what is happening. Please know that these feelings are a normal reaction to what we are going through and that you are not alone. We have mental health resources available in our province for support and guidance. Visit bridgethegap.ca, gap with 2 P's, to access these services. If you need to talk or if you are experiencing a crisis, you can call the Provincial Warm Line or the Mental Health Crisis Line. We want our children to continue to play, explore, learn, have fun, and feel safe. We must also remember that social distancing applies to children as well. I ask parents not to hold playdates or sleepovers for their children. These activities make it difficult to maintain the principles of social distancing. There are many activities, however, that family and children can do even when applying social distancing from others. We can sing songs and dance, encourage active play in our own backyard, read books, and go for walks, all while respecting the principles of social distancing. While schools may be closed, daily routines such as regular bedtimes and meals are important for children and teens. Help your child stay socially connected to friends and loved ones through technology like Skype or FaceTime. I would like to now speak directly to the young and healthy people in our province. Even if you are not experiencing any symptoms, it is vitally important that we all adhere to the public health recommendations of social distancing. When you are with others, or if you must go out for essentials like groceries, please remember the importance of adhering to the 2 arm length distance. Social distancing, however, does not mean no social contact. We need to think about socializing in a new way. Connect on social media, call your friends, use technology like Skype. We are all finding new ways to connect during this challenging time. If you are on self-isolation because you have returned from travel, while you cannot visit grocery stores or other areas where people gather, you can go outside for a walk or a hike while maintaining social distancing, as long as you have no symptoms. If you are symptomatic or become symptomatic, you must, however, stay home. A reminder for everyone that if you are feeling unwell or experiencing symptoms of COVID-19, which include fever or cough or difficulty breathing, please complete the self-assessment tool on the 811 website. Yesterday, we declared a public health emergency. We did so to ensure we could put measures in place to help protect the health of our population. I want to thank everyone for your patience, understanding, and your collective actions to help us reduce the spread of COVID-19. We all have a role to play to decrease the spread of this virus and to protect ourselves and our loved ones. Thank you. Open to questions.
Dr. Fitzgerald, just wondering if you can tell us about any kind of plans that may be underway to establish drive-through COVID-19 testing centers.
All the RHAs are looking at assessment and testing centers. Drive-through models have been used in other jurisdictions, and everything is under consideration at this time.
Are there any chance those might take place at schools?
So the RHAs will be involved in the planning of that, and as I'm not aware of any that are taking place in schools at this time.
I'm curious, any more updates about the 3 cases now, one confirmed and 2 presumptive?
With regard, yes,
symptoms.
Still mild symptoms and doing well as far as I know.
There are a lot of people who are either just coming back from travel now, they're making their way back, or some who may have been back for a week, they're starting to feel a little bit stir-crazy, and they're wondering, okay, what activities can I do, what activities can't I do? So I'm hoping I can just go down a couple of lists and you can yes, no, or maybe.
Okay.
I guess kind of a doctor may I. So if they wanted to go outside in their yard, do activities within their own property.
So if they're coming back from travel, and they have no symptoms, okay? So if anyone has symptoms, you must stay home. So if they have no symptoms, it is still okay to go outside on your property as long as you're maintaining the principles of social distancing.
What about if they wanted to go for a ride in the car but not actually get out, just to change of scenery?
They were by themselves, yes.
What if they wanted to invite people like close family over, but wanted to still keep a distance, but invite them into the house, for example?
We'd recommend that not happen. We want to reduce the spread of this as much as possible, so we wouldn't want anyone to be, we think that could be avoided for a 2-week period.
What about interacting with family who may be in the same house who didn't travel, they're healthy, and they're not isolating, they're still going out and about? What's the guideline there?
As long as the person remains asymptomatic, the evidence right now suggests the risk of spread is low. However, we still would recommend that you try to stay away as much as possible. So if you have the ability, if you're lucky enough to have your own bedroom or a bedroom that you could use, your own bathroom, obviously have your own dishes, don't share utensils, that sort of thing. Just try to separate as much as possible. If you become symptomatic, of course, that's a much more important to do.
And follow-up question comes around enforcement, because there's some people who say, wait a minute, my neighbor across the street, I know they just got back from down south, and I noticed that he went out to the grocery store today. What should they do, seeing as how there isn't any sort of enforcement mechanism in place?
So I think, we hope that people will adhere to this, understanding now that it is law and that you must stay at home. Certainly, if someone is out going for a walk in the neighborhood, that is okay to do. Going to the grocery store would not be okay. It is difficult to know what to do. People don't necessarily want to be, tattling on their neighbors and that sort of thing. But if you have concerns, certainly you can reach out to somebody, and and you may even want to just remind your neighbor distantly of that the law has changed.
Dr. Fitzgerald, is the province looking at any trial drugs? We know that in the States there's a few that are being considered, a malaria drug that seems to be taking well as a brand name drug, Plaquenil.
Okay. So treatment with these types of drugs that's out of our provincial jurisdiction, those things happen at a federal level with recommending which should be used, and there are processes in place to avail of any medications should that need arise.
In terms of the region, Labrador-Grenfell, I know that lands in both Labrador and Newfoundland. Some of the maps that are out there, Johns Hopkins University, for example, is showing the cases in Labrador. Can you speak a bit to this?
Yeah, I think that's just because of where Johns Hopkins doesn't know where those cases are. I think that's just where they put it on the map because of that's where the majority of the region is, right, is up there.
Okay, let's go to the phone lines. I understand there's 4 reporters there. We'll take first question from whoever has a question on the phones.
Yes, hi. Marie-Isabelle Rochon from Radio Canada. Wondering, so the province has tested 684 people. Is there enough resources for testing everybody who needs to be tested? As I understand, there's a long period of wait. People call and they don't get tested right away. So what is the province doing to get more people tested?
So at the moment, everybody who needs to be tested will be tested. Public health nurses are going in to do the testing. It may take 24 hours or more to get that testing arranged at this time. And everyone, though, who needs to be tested will be tested.
Is there enough nurse and testing kits in the province?
We do have enough testing kits in the province, and certainly with regard to nurses, we do have enough.
Yeah, I'm wondering about the 3 positive cases. I didn't quite catch whether any of those have been confirmed yet.
Yes, so our first case has been confirmed.
Okay. Why is it taking apparently longer than the average time to get those results back?
So I think there is an increased volume at the National Microbiology Lab at this time. They've tested many thousands of tests, so that may explain the slightly longer time.
Yeah, I'm wondering about ventilators in the province. Can you give exact numbers if the province is attempting to procure any more from manufacturers?
My understanding, as of last count, there was about 156 ventilators in the province, and the purchasing of ventilators and those sorts of things are outside of the shop of public health, so I'll have to refer you to someone else within the Department of Health for that, to answer that question.
So, can you say if they are trying to buy any more?
I think at this point, they're looking at their supplies and trying to decide, but I'd have to refer you to somebody else in the Department of Health to answer that question specifically.
Okay.
Hi, this is Diane Crocker from the Western Star.
Yes?
I know you did mention about the swabbing centers. You asked briefly about it. We're seeing construction actually happening out here in Corner Brook of some kind of a mobile center and Civic Center parking lot. Wondering if that one will be used for swabbing, and we're also hearing of using the Stephenville Dome for a swabbing station. Do you have anything on where these stations will be located?
At the moment, those plans are being developed by the Regional Health Authority, so I'd have to refer you to them to know exactly what's happening and where those are going to be.
Do you think it's necessary, though, to let the public know as soon as you can to where these things are and why they're happening? We're getting a lot of, rumors and conversations going around the community.
As soon as the regional health authorities are ready to go ahead with any type of assessment centres, I'm confident the public will know.
Okay, thank you.
Is there going to be some kind of line set up for people to report possible violations under the now public health emergency? Like we saw that first number come out, but that wasn't real. Is there going to be anything like that?
At the moment, there's no plans to have something like that.
Okay, and I've had a lot of people asking too about, when walking outdoors, places like Bowring Park, which has been very busy over the last few days with the nice weather, just walking with friends and dogs kind of in between people as a barrier. Is that okay?
So you need to make sure you can maintain 2 arms length distance between you and another person. I mean, obviously, if you're a parent who's walking with your child, you're not necessarily going to do that if you're in the same household, but if you're walking with a friend, or if you're, just in a busier spot, it's a good idea to try to maintain that social distancing. We know that being outdoors is likely safer. The virus, cold air will kill the virus. However, if you were really close to somebody and there was coughing, as with any virus, there is that chance. So you'd want to maintain that social distancing.
I was wondering, in the last 24 hours since we had a press conference, if we know anything new scientifically about COVID-19, like how long it can stay alive on surfaces like maybe pet hair or just your sink.
So I haven't heard anything new with regard to that, and specifically with respect to pets, I haven't heard anything new. But the information is changing very rapidly, so we may have more information tomorrow. You never know.
Question about 811. We've seen a lot of concerns from people about how long it's taking to get through to someone and then how long it's taking to get a call back. What are the sort of wait times right now, and what sort of backlog are we looking at?
So I think the backlog has been decreased significantly. I don't have the numbers in front of me right now, but they've added, I think, 14 more nurses as of yesterday or a day before, and the wait times to get a call back have reduced significantly in that time, and there has been a great uptake of the 811 assessment tool online, and that has certainly made a difference. So we do thank people for using that.
We've seen the Newfoundland and Labrador Liquor Corporation announcing that they're closing their stores this weekend to in-person visits. Was that something that was done on your recommendation? Because a lot of people are saying, well, hold on, how's that any different from a grocery store that's going to continue to operate? The risk should be fairly comparable here.
No, I think the liquor stores or the NLC decided that of their own accord. They felt that they could fulfill the orders by doing it that way.
Dr. Fitzgerald, just looking for some clarification. I know you went over when it comes to 50-plus people and these other businesses that weren't ordered to close. A lot of questions about car dealerships, hair salons, and spas, for example, because that is a close proximity dealing, right. But generally it's under 50 people.
So I think right now, I mean, all of those things will come into consideration as the evolution of this outbreak changes. If we start to see community spread, then obviously we're going to be much more careful about any kind of situation where that may happen. In those situations, though, if people are able to do a brief screen to see if someone's traveled or if they've been sick. Well, if someone's traveled in the last 2 weeks, they shouldn't be going out to get their hair done. But, if there's any risk factors that they may have, if they're unwell, obviously we wouldn't recommend that you do somebody's hair if they have cold-like symptoms or flu-like symptoms. So I think there is a risk assessment, and I certainly would refer any of those groups to their professional associations to get guidance on that.
If somebody on St. Pierre-Miquelon was to become ill with COVID-19, are they coming to the province, and what is being put in place to monitor that situation?
So my understanding is that Eastern Health has an agreement and understanding with France and St. Pierre-Miquelon to be able to care for patients there who need care, whether they have COVID-19 or anything else. All the same precautions that we would put in place for anyone who presented to an acute care hospital with COVID-19 will be in place for someone from St. Pierre-Miquelon.
Let's go back to the phone line. So if any of the reporters on the phone have follow-up questions.
Yeah, I have a question. Hello?
Yes, yes, go ahead.
Yes, okay. Would having 72 rolls of toilet paper in your house reduce your chance of contracting COVID-19?
No, I don't think toilet paper is protective in any way, other than, excuse me, it might, sorry, I have a dry spot here. It might actually help you to not have to go to the grocery store as much, I guess. Sorry, I promise I'm not infectious. It's just a dry spot in the back of my throat.
Okay. So in terms of people hoarding, can you sort of go over again what people should actually be buying? I'm sorry, are you going to be okay?
Oh yeah, go ahead.
Sorry. Okay. What people really should be focusing on when they go to a grocery store or anywhere else?
So I think, groceries and goods are still coming in as they normally would. That traffic has not been changed. So I think people need to realize, if there is a chance you might have to isolate yourself, then certainly you want to make sure you have enough to get through 2 weeks. So, produce or canned goods, packaged goods, that sort of thing. But chances are you're not going to have to be in your house for an extended period of time where you would not be able to get some groceries. So, hoarding at this point is not necessary. I think to some degree it fuels panic and hysteria, and we have to be very careful about that. We are being cautious because we want to reduce the spread of this virus, but we have to, at the same time, realize that we don't have to be alarmist about it.
Thank you.
You may have spoken to this, but these big work sites like the Muncore Science Facility, Grieg in St. Lawrence are still operating. What do you recommend there for those employees?
Well, for any employer, we recommend that they try to, or that they put in place the principles of social distancing to ensure that their workers could work safely. Depending, I understand there are some bigger work sites that are going through the process of trying to reduce their workforce so that they can allow that to happen, and certainly we commend them for doing that. We understand that many of these places still have to have a certain number of people working there to be able to maintain them and to keep them safe. So, as much as possible, we would want employers to try to reduce social distancing or put measures in place to improve social distancing, sorry.
And on that, kitchens, a lot of restaurants are switching to a takeout model, but kitchens are often fairly close quarters. Are there any concerns about the staff within these facilities, even though it's a fairly small gathering, usually of people that are in there?
Well, first of all, if anyone is sick, they should not be working. So that's the one thing that you can do to keep it safe. People who work in kitchens generally tend to be very good about hand hygiene, so that's important. We recommend, of course, no tasting, which can sometimes happen in kitchens, I'm sure, and to try to, as much as possible, put measures in place to improve social distancing. So whether that's to increase table space so that people can work a little bit further apart.
I've seen some concerns about military flights. This is often people, and American military crews, for example, end up laying over here, flying across the Atlantic. So one person, for example, saying, okay, well, I saw them all checking in at the counter, at a hotel in town. Do they have to abide by the quarantine restrictions because they're obviously flying in from outside the country? And what measures are in place in order to make sure that there isn't that interaction then between them and the general public?
Okay, so screening still has to happen. So if there were any concerns with screening protocols, they would be addressed at that time. If people are asymptomatic, if they're not staying over long, I think it depends on the place that they're going, I guess. That would be the most important question there, where they're heading to. So, you know, that may be, I may be able to get a more defined answer for you if you need that.
Over the last week, we've heard a lot about flattening the curve, and we have a brief window of opportunity to do so. When does that close?
Well, it very much depends on what we see in the coming days to weeks. The thing about some of these public health measures that, you know, if we put them in place and they work, we may not see a steep rise in the curve. And so we hope that we can say then that they worked. But it's sometimes that can be difficult because you don't know for sure if those measures made the difference. But certainly what we would do is compare the rise in our curve to the rise of the curve in other places, and that would help us to know if we're making a difference or not.
Dr. Fitzgerald, now that there are more than 770 cases of COVID-19 in the country, a lot of those in Ontario, Alberta, and BC, are we going to start looking at needing to self-isolate after traveling out of province?
So those are questions that we are considering, and we reassess that risk every day. And, you know, it's not off the table at this point, but at the moment we're not there. But as you've seen how things can change quickly in the last week, you know, that it could change very quickly.
Is this something people should be maybe being mindful of on their own and looking to do themselves?
We would certainly encourage anyone who has traveled outside of the province, if they feel they can, to self-isolate once they get home for 2 weeks. I would encourage anyone to do that.
Question on the phone from Peter Jackson.
Yes. I want to ask whether anything that you, is there any advice about avoiding COVID-19 that's specific to COVID-19 that you wouldn't be advising about any other cold or flu virus? Is there anything specific about this virus that people should be conducting themselves accordingly?
At the moment, no. It appears that it is spread through droplet transmission, so through, you know, droplets that are sneezed and coughed. So we would be recommending the same precautions that we put in place for most respiratory viruses. Just to wash your hands well, make sure you maintain social distancing, those sorts of things.
I have one more from the phone.
Go ahead.
That's for me?
Yep.
Okay, yeah. I'm wondering if you're aware of, based on kind of the orders that were announced yesterday about around businesses and gatherings, if there was any fines or kind of enforcement that had to take place as of today.
Sorry. No, I didn't catch that all. I'm sorry.
Gatherings, were there any fines that have had been placed today?
Oh, no. No fines at the moment.
We've so far still only have 3 cases. Dr. Haggie, several briefings ago, talked about the fact that we have, so far, I believe around 60 people have been hospitalized because of flu, you know, hundreds of flu cases in the province. What do you say to people who are saying, why are we taking so many precautions for a disease that have only had 3 cases when it's had way less impact on the province than the seasonal flu has?
Right. And that's a good question. This virus is new. None of us are immune to it. There's no vaccine for it. There's no treatment for it. And the number of people who get severe disease from it is higher than the flu, and the number of people who die from it is significantly higher than the flu. We want to avoid those 2 categories as much as possible, obviously. So that is why we are concerned about this, and that is why we're trying to get out ahead.
I know I asked about the province-to-province traveling. Are we looking at closing our provincial borders? I know there's been a lot of chatter online, mainly today, about that now that we're looking to close the Canadian-U.S. border.
To the best of my knowledge, those conversations have not occurred at this point, at least not involving me, so I can't comment any further than that.
And contact tracing for now, the 1 confirmed, 2 presumptive, how is that going?
That's going well. I believe most, if not all, of the contacts have been traced and appropriate measures have been put in place.
Okay, I think
We're done?
we're good.
Okay, thanks, everyone.